And I'd like to start out with hoof abscesses are a very common thing. We get to look like heroes sometimes because sometimes hoof abscesses make the horses severely and acutely lame. And sometimes with very, very simple intervention, we are able to save the day in the owner's eyes. Brief story before I start. A couple of years ago at the Veterinary College at Cornell, I was told that we have a horse with most likely a severe fracture, and to be ready for him when he came in, probably to have to pull a shoe. The horse came off the trailer, extremely lame, non-weight bearing. The clinicians went over the leg, made sure nothing was displaced. Seemed like it was lower leg. They asked me to pull the shoe, and I said, if you're going to radiograph this, do we want me to clean it out a little bit? And they said yes. So as I am cleaning the foot out, and I looked at the horse's conformation and how he was built, and I looked up and I said, you know, if I was going to look for an abscess on this horse, I would look right here. And I took my knife and took one swipe, and pus geysered out and hit one of the vet students right in the chest. The horse was immediately sound, and we soaked it out. There was no fracture, and everybody was happy. So that's how you could look like a real hero. And if you look at this foot on my title page here, this abscess in the heel is caused by this horse's conformation. If you look at the right side of the foot, it flares to that side, and you can see the left side of the foot, it wants to crush and run under. So that's a great place for abscesses to occur. Next slide. Let me just get going here. So let's talk about causes of abscess. Well, the definition first is a sepsis or an infection of the corium of the horse's foot. This can be caused by small grit being driven in, a puncture wound, a close-driven horse nail, necrosis of the laminae. Sometimes when horses have laminitis, chronic laminitis, you get bits of tissue that slowly decay. You can also have a sequestrum, we call a bone fragment that's floating around. That necroses and causes an abscess. And the pain is generally caused by a buildup of pus in a contained area or gas, or sometimes the pain is just basically the exposure of the sensitive tissue. And so the horse can be lame for a variety of reasons and for a variety of causes. Obviously, if you have a penetration injury, a very sharp object coming in and sealing up the hole, that is another way an abscess can occur. These are my favorite tools for looking for abscesses. Up on the left is one of these thermal temperature guns where you can take a reading off the horse's foot. And generally, your feet are going to be a little bit above room temperature. And if you go around the foot, you can probably pick up maybe an additional 5 or 6 degrees in one spot, especially if you're around the coronary band, and that will at least tell you the side of the foot that you might be looking in. Certainly the hoof tester is down below, where you can systematically go around the foot and squeeze in a couple different places. If you get no response, squeeze a little harder, but be aware that you can cause pain with these, and even if there's no abscess. So what I like to do is, if I see where the horse is sensitive in one area, I keep going around the foot. I don't keep cranking on it. I go around the foot, and then I come back to that same spot. And then if I squeeze with the same amount of pressure, I'm able to get a similar response. And then I keep going around the foot again, and then I come back to that spot again, and I try to squeeze with the same pressure again. And then I'm pretty sure that that's a likely spot. It's like the old adage, you need 3 points to draw a straight line. The other thing you can do with the hoof testers is squeeze an area, and maybe the horse isn't very painful because there's some release of the pus or liquid going on, and you could actually see some of it ooze out because you're squeezing the foot. So the hoof testers can be used in a variety of ways, and you certainly can misuse them if you over squeeze, put too much pressure on. We could pretty much make any horse sore with them. And above the hoof testers is a small loop knife, which I use for digging out, some of these holes. You see a little black mark and you want to follow it. And then the larger hoof knife, again, same thing. Very useful for going around the outside of the foot and cleaning things around the junction of the sole and the hoof wall at the white line. So we want to kind of inspect. If we can't find anything obvious, we tend to look right around the foot. Clinical signs are the horse is generally lame, in some cases non-weight bearing, like we talked about. The horse is responding to the hoof testers. We have heat. We may detect a strong pulse. We may even see drainage in some areas. And sometimes when we're examining the foot, we just see a black spot where there should not be one. That's quite often a telltale sign. And sometimes it's just a tiny, tiny little pinhole, but a black spot on a white foot on the bars or the white line that's not supposed to be there. And sometimes it's worth looking a little further. Sometimes that little black spot disappears, and other times this thing gets bigger and bigger, and some of this black goo or bioslime comes out. And again, that's usually what's going on, and we can tell that there is some sort of an abscess growing. What we like to try and train the vet students to do is I like to take a black marker and put dots in specific spots and have them show them how far they have to dig through with the small loop knife to get through the horny sole and get down to the sensitive sole where that abscess likely is. So we find abscesses in common places. Here's a horse that had a shoe put on. The nail holes really are pretty good. One of them's a little bit questionable, but you can see where this horse has some type of puncture wound inside the white line, and that needed to be paired out, and actually that was really no big deal. But I find there's common areas where I look to find abscesses. And if you look at this foot here, you see a bunch of different things going on. This was a foot in a pretty rough shape. We'll start on the left. I would say that abscess is probably created by a close horse nail. The abscess up on the right, about what I would call about 1 or 2 o'clock if you're looking at a clock face. That's more of that medial wall just pulling away. We see a lot of times we see abscesses at the apex of the frog or at the bar, like I circled down below. All these places I call tissue junctions. Whenever the tissue changes, like the horny sole attaching to the white line or the horny sole attaching to where the frog is, there's a difference of texture of tissue. There's movement. There's a place where things can get forced into little bits of grit and other things. Obviously, a nail puncture, what's commonly known as a street nail, can happen anywhere where a horse steps on a sharp object and has a penetration injury, and that turns into an abscess. And if we use the term street nail because that's an old term actually, when a lot of these horses that were used in the streets delivering vegetables and milk and ice, and nails would fall off and step on them and get puncture wounds, and it was pretty common to have street nail injuries when they were using horses for as a delivery mode. So the other evidence we see of abscesses, this is a abscess that has came from the bottom, blew out the hoof wall right at the coronary band. A lot of these abscesses try and go to the direction of least resistance and finally come out. So you would probably find a whole tract top to bottom where that is, and this abscess maybe never even made the horse lame because it was constantly tunneling itself, and finally it released, and quite possibly this horse was never even lame. So there's all kinds of things that can happen in the hoof wall. Sometimes it's pretty evident, and sometimes these things go unnoticed. Um, so sometimes you see a foot like this on the left, and you see an area that you want to explore, and you say, gee, this foot's pretty beat up, and let's pare this out. And we pare out a little bit more, and I said, oh my God, it's underneath the bar, it's everywheres. And then as we keep paring and paring away, you see all that black bio slime that's underneath there. That's been going on for a long time. That didn't happen overnight. This is just something that this horse has lived with for a while. And again, possibly never even really been lame, because there was never any buildup of pus or gas. But this foot is all eaten up, and this horse might be lame if it, with all this material cut away. But actually, this foot will come along pretty good with a good soaking and cleaning. We talk about these gas pockets. Here's a lateral radiograph of a horse, and that little dark area in front of the tip of the coffin bone on the upper right radiograph, that's called a gas pocket. And that's going to make a horse very lame. There's pressure. There is no place for this pressure to come out until you release it. And so you see this area right there, and it doesn't take much of paring away right there. The sole is not very thick. This horse is mildly rotated, and you can see a little defect on top of the upper end of the hoof wall, and that's probably associated with the laminitis event. The horse also has a very flat palmar angle there also. In the lower left radiograph, right inside the yellow circle, there's another gas pocket right on the tip of the coffin bone, and that's a really, really bad one right there, because that's actually touching the coffin bone, and this could be a life and death situation for this horse, because if this coffin bone gets infected, you have no choice other than to debride the area and cleanse it, or to euthanize the horse. You cannot, there's no halfway here. So this might even be a surgery. Talking about penetration injuries, so the radiograph on the left, you can see this horse stepped on a power screw, and it went in pretty far. The horse was immediately lame. And this power screw can, even though it's a clean looking screw, it could bring in all kinds of bacteria, microorganisms to a very vulnerable, sensitive area. You've got the deep flexor tendon right there. You've got all kinds of things. So we never want to just yank these things out. If we can radiograph these feet and see what structures could be damaged, that will guide us really well on how we're going to take care of them, and to know how serious this event is, or whether maybe it hasn't hurt anything. This particular horse with the screw in his foot was actually one of the research horses that was being used on the treadmill here, and he stepped on the screw as he was walking from the barn to the treadmill. Immediately lame. They had me come look at it. I said, gee, there's a screw in this horse's foot. I ran back to the shop, got a big, thick piece of foam, cut a donut hole in it, duct taped it on. So now the horse could walk without putting pressure on that, and you can see him compressing this piece of foam underneath the shoe. And we radiographed it real quick to see where it was, and then we actually unscrewed it to take it out and treated it. And it just barely nicked a few structures, but this could have turned into a terrible abscess for this horse. The photograph on the right, you can see inside the circle, there's a little nick of the coffin bone and then a very dark spot. These dark spots on a radiograph usually indicate a gas pocket or a liquid pocket. And again, this is a long-term serious infection. This horse got nicked somehow, broke a little piece of coffin bone off. Maybe this little white thing at the bottom of the circle is a bone fragment. And again, these things abscess and cause all kinds of problems that usually require surgery. Some of these horses, they get an abscess in their heels and they just blow out the heel, and you can see this foot's kind of beat up to begin with, so just another location. And quite often these are caused by conformation. The foot isn't a sturdy enough foot to be barefoot without a shoe in many cases, and little bits of grit just get driven in places which cause problem, especially if the horses are not taken care of on a regular basis and so on. And sometimes some of these abscesses do a tremendous amount of damage. This particular foot here had an injury right to the front of the foot that went unattended. The infection spread and made a huge abscess. We dremeled out so much looking for it. The horse was hardly weight-bearing on this leg. I put a little patch across the front of it because by the time I got done dremeling following where this abscess grew, I had something that looked more like a cow's foot than a horse's foot, and I was worried about it splitting apart. So we radiographed it and couldn't see a darn thing. We can't find drainage. The horse is extremely lame. We could see a little bit here where I've done my dremeling. And then we put contrast dye in, and we re-radiographed it, and sure enough, all those little white places, you see this contrast dye where this abscess is spread all around this coffin bone, really causing a lot of trouble. So this is a really serious case. So we put the maggots in there. I glued a aluminum strap across the front, and we put maggots in there to debride where we couldn't get. And sure enough, the horse was weight-bearing within 2 days, and we made progress from there. This is another type of abscesses that we get from a horse that had a serious sinker event. And so as the coffin bone has descended down and all the laminae has left loose, then we have this serum and abscessing going on around the whole, below the whole coronary band, and then, you know, right up and down the whole front of the foot. And this was a horse that had Potomac fever, very high fever, and quite often these horses do sink, and there's a lot of new hoof that has to be grown to help this horse, and it's a long road. Another foot that had similar problems, you can see the kind of drainage you get from that abscess, very serumy. It imitates the line right there, imitates the I don't know if you can see my cursor, imitates the actual coffin bone, sorry about that, right across there, and you can see how all this is draining out of this, and this is another horse. Quite often when we have these abscesses, if we have to debride an area, we use the loop knife and go around and we search, and we're usually searching around the junction of tissues, so we're looking at old nail holes, we're looking at little black spots, and then as we debride these areas and don't find anything, we look further, and of course you see in this horse's foot here how that I actually found an abscess further into the sole, more like a puncture wound abscess. So that, you know, these things can occur anywhere. You have your usual places where you look for these things, and then that little black spot down there, that right about there where the cursor is, you can see that that's also a potential, and it's probably connected to that. Here is a horse off the track, barefoot thoroughbred, turned out, ran around like crazy with a very thin sole, punctured the sole, and then just had this huge abscess going right there on the right side of the apex of the frog. And sometimes these horses shouldn't be doing that. Very difficult sometimes to control what these horses do. And this horse had serious trouble, quite an infection going on there. Chronic laminitis, you have a lot of laminar disruption, and stuff gets in there if the horse owners don't really keep after this stuff. and then you get these extensive destruction of the hoof wall and hollow spots in there, and then they quite often don't see this stuff till it's too late, and then they bring them in, and we have to debride all this stuff to clean this foot up, and there's not much to put a shoe back on here, so we're usually trying to either glue or cast or do something to give the horse frog support and promote good, healthy growth. And a lot of these horses, if you just keep after them, you could probably, help them out a lot. But you got to clean them up first, otherwise they're going to, continue to, eat this horny tissue away, and then you have nothing left for the horse to stand on. Here's a very extensive abscess. It undermined a tremendous amount of sole. Horse was severely lame, and this abscess went right around from one side of the foot to the other. Again, these things don't happen overnight. Quite often the horses are either not trimmed regularly or they're barefoot. They're usually companion horses that are just out. They're not doing much with them, so they're not paying attention to them. And you can see the close-up there, how much oozing there is and how much wet stuff. And when we had the horse even standing, that's all pus that just oozed out once we opened it up. And again, this horse was extremely lame, could barely walk, and this pus, there was probably a shot glass worth of pus that came out of this foot by the time we were done opening it up and cleaning it up and everything. And we did shoe this horse with a treatment plate, and the horse did pretty well after that. Again, another chronic laminitis abscess. This horse wasn't taken care of well for a while, had feet falling apart, and tremendous hole developed in there. And again, these horses will come around once you take the time and put in the due diligence to help them. But that horse had quite a hole, and that hole communicates right down to the bottom of the foot. Sometimes when we work on these horses, we glue on shoes, and I cut the fabric away, and so now we can treat the front of this abscess area. We don't want to close these things up if there's any chance of there's any of the offending material in there. We don't want to close up anything that has anything leaking out of it, serum or anything. We want to be able to just continue to dry these things up and not close them in. In really wet weather, you have to be real careful if you use any pour-in pads or anything like that. If you get an abscess underneath, you just create more problems. So we like to try and mix copper sulfate with the glue when we glue these shoes on, and we mix just copper sulfate crystals in the pour-in pads too, and that helps keep these things from causing problems. Here's a neglected heel abscess. Again, quite often something that gets this big for this happened over time, and these horses are just not seen often enough, and that's the damage that happens over this length of time, and there's a lot of new hoof that needs to be rebuilt here and taken care of. But you can bring these horses around if they'll just take care of them properly. This particular foot was on a horse that was being ridden extensively barefoot trail riding. Got a piece of grit in there, and they kind of played around with it. The horse was lame on and off, so when the horse was sound, they said, "Oh, I guess he's okay," and then he'd go lame again. So it was a constant. But this piece of grit worked its way in, and because of the time that this horse had this abscess going on for a real length of time, it worked its way right into the coffin bone, and needed, again, life-threatening situation, because he had to have a coffin bone debridement. So we have to open all this up now and take some of the infected coffin bone out of there. And this started out as just a basic little abscess that could have been taken care of. One way to stop something like this happening is if we shoe the horse, and then we're covering that junction between the sole and the hoof wall, and we keep a lot of that grit from getting up in there. But this horse did come around after we debrided the coffin bone, made a quick little treatment plate with a little frog support, and put that on him, and the horse came by on a regular basis, and here he is 6 weeks later. He's really doing well. We had to rebuild that area, had to take all that out of there, but this was a very good success story for this horse. This is the open-up pad that Mustad makes, and if you have an abscess or an injury in the central part of the foot right around the frog, very easy to protect this and treat it at the same time. So a treatment plate is more extensive, harder to make. One of these, if the abscess or the injury is in the place right in the center of the foot, these pads are really, really handy to do. They're not expensive. You put them on like any pad, any other pad. We just rivet the heels. You can position this around the foot just a little bit more, move it backwards, move it sideways. And then you know, it's actually reusable. One tip though, it's fairly hard plastic, and once you have everything all set up, I just take an 1/8" drill bit and I drill all the nail holes through this stiff pad. Much easier to nail it on that way. Here's a chronic abscess on a laminitis horse that I've been seeing regularly. This is a Mustang that, because of the amount of forage she could consume around in the Northeast here, as opposed to where they originally came from. So this horse basically overate and has a chronic laminitis, and she a lot of damage in there, and a chronic abscess in the toe. We glued on a shoe, and we just put in a pour-in pad to serve as a frog support, and then that area is open to be treated, and it needs to be treated just like a wound. It's on the bottom of the foot, so it needs to be soaked occasionally. Cotton ball with some thrush buster works pretty good. You can take it in, replace it, and that's what we did there. These sequestrums cause abscesses, and this is a pretty serious case. And you can see in the radiograph on the bottom right there, a piece of bone had broke off on this foot and then abscessed. And then the client called up and said, "I have a quarter crack that's bleeding. Can I bring the horse in and get it patched?" And I said, "No, I think we need x-rays." And then we saw this, and now it turns in again another life and death situation. We need to take that out of there. The abscess that is created is eaten away at some of the coffin bone. It's caused extensive damage. So what you see on the outside sometimes is just not entirely helpful until you see what's on the inside. But this horse, we floated that heel, put a half heart bar on it and a treatment plate, and this horse progressed. Treatments. We like to debride the area of any debris and tissue, establish drainage if we need drainage. Got to get all this pus and stuff out of there. You can cleanse with peroxide, chlorine dioxide straight out of the bottle, saline. We like to soak in Epsom salts. Epsom salts mixed with betadine. It works pretty good, or the activated chlorine dioxide solution, which I'll talk about in a minute. We treat with betadine, iodine, thrushbuster. There's all kinds of stuff on the market that works pretty well. We're trying to cleanse and dry the area up and treat it like any kind of wound. We want to protect it with a wrap, a boot, a treatment plate, anything that we could to be able to access it and treat it and protect it at the same time. I use a lot of this to clean up especially extensive abscesses. We mix 1 part white vinegar, 5 parts chlorine dioxide, and 10 parts of water, and then we put it in a soaking bag. And we're lucky, we have lots of these used IV bags around, and so you don't need a lot of solution, because if you mix the chlorine dioxide, which is white lightning, in the 1:5:10 ratio, you only need about that much to soak a foot. So it's very cost effective. If you mix Epsom salts up, mix them with warm water, and make sure you mix a cup to a quart. That makes what's called a hypertonic solution, which helps draw out all that bioslime. You can add betadine to it if you have some available, and we do that sometimes too. And there are other oxy solutions and products on the market. They all work pretty good. They all great cleansing agents. So we duct tape that on the end of the horse's foot, and they're standing there soaking in that bag, and you leave it on there 15 or 20 minutes, and you don't have to worry about the horse kicking a bucket over, and it works pretty good. We have so many IV bags, used ones, that we give them out to all the local horseshoers so they have something to soak horses' feet in. And this horse, that picture on the right is that horse with the maggot debridement that had extensive destruction of her foot. And you can see on the left, over a year later, we have a whole nice new foot grown out. Horse is back in work, doing pretty well. And so I thank you for listening tonight, and I'll take any questions.
All right, terrific. Thank you, Steve. That was a lot of great information packed into a short amount of time. In case you came in late, I'll point you out to your control panel. We have some time for some questions and answers. We got a few in already. So feel free to type any in, and we'll go through as many as possible. Steve, here's the first question. Have you had any success using sugardyne?
Yes, and I'm glad you mentioned that. That's enough for some of these really nasty things. Sugardyne works pretty well, especially for some of the more extensive stuff, and you know, that should be in the list of treatments. Sugardyne is you make a paste with table sugar and betadine, and I kind of strung this together in the last few nights, and yes, that should be included. So thank you for bringing that up.
I'll tell you what, we have a free downloadable paper on sugardyne. I'll make sure to link it in case anybody comes to watch this tomorrow. You'll find a link to that on using sugardyne. Okay. Next question. Someone's interested in your temperature gun, Steve. How else are you using it besides identifying an abscess?
You know, a heat further up the leg. If your horse has like a tendon or other soft tissue strain, hock problem or something, you can actually detect some heat if this horse has injured himself. I've used it to see, we have a duct work to get the heat out of the shop, and I've used it to see how well the forge heat has been moving through the ducts, and then every now and then we use that laser to keep cats entertained.
Okay. If people don't have a surplus of used IV bags lying around, what would you recommend soaking foot in?
If you can get some kind of really heavy-duty poly bag, they are available. They're more industrial type stuff, but what's nice about these things, it's kind of like, you know, I like to recycle stuff. They'd be thrown out if we didn't use them. And so they're very heavy-duty. Being that we have them, I've never looked for anything else.
Okay, and you showed a couple of horses that were barefoot, and someone has a question. That's a hypothetical of a horse gets an abscess resulting from activity from being barefoot, and the horse has since recovered. What advice do you have for managing that client that wants to keep their horse barefoot, but it does need that protection with a shoe?
Well, that's a difficult thing because quite often, people are being barefoot for a variety of reasons. Some, they're trying to save some money. Some just believe that horses shouldn't wear shoes. But so much as we've talked about with the width protocol thing that I did, is there are so many variables, and sometimes there are some horses that just need that kind of protection. And maybe you can get away with boots to stop stuff from getting pushed into the bottom of the horse's foot, and maybe that will work just fine. But a shoe, I think shod horses are less likely to have abscess problems if they're properly shod than barefoot horses in work.
Okay, and I'll tell you what, we have an article that Steve wrote about the width protocol. Steve, would you mind just giving a quick introduction to that before, and I'll link to that article also with this webinar after the fact?
Oh, sure, sure. So the WITH protocol is an acronym that I use to talk about, an objective way to decide whether the horse needs shoes or not. And so the acronym is WITH. W stands for work, and that's a fair question. What kind of work does the horse do? Certain types of work, shoes are absolutely necessary to be competitive and last doing that work. There's other types of work where many horses can be shoeless. I stands for intensity, and intensity means how much power are we transmitting to the ground. A dressage horse is very collective. He is transmitting a lot of instant power to the ground under the collection. A horse pulling logs out of the woods is trying to transmit a lot of power to the ground. So we have to have a way to interface the ground. Galloping horses are very intense. They have to have it's quick steps hard into the ground, and that can put a lot of force on the bottom of a horse's foot, which a shoe can help distribute properly, balance properly, and protect. D stands for duration, and that's pretty simple. Duration could be a distance covered, a training schedule, a showing competition schedule, or whatever. So again, obviously the greater the distance, the more strain on the horse's feet, more likely the horse needs shoes to deal with that. T is terrain, and terrain includes the environment and weather. There are some types of terrain that are very forgiving to a lot of horses, and they can be barefoot, especially if they have superior genes and good management. Another type of terrain is very unforgiving, and weather changes can change terrain from hard, dry fields to very muddy fields, and so weather has a tremendous influence on terrain and horses' feet. And then finally, H stands for the individual horse. There are some types of breeds of horses that do much better with shoes. They're thin-skinned, light bone, small and delicate feet like thoroughbreds. There are other types of horses that genetically have very good genes for good solid feet, and again do better without, do just fine without shoes, especially if you consider some of the other parts of the WITH protocol. And how is this horse ridden? How is it kept? What kind of husbandry? What kind of individual problems does he have? Is he built pretty well? Is he got conformation defects? So we can balance the foot better, especially if the foot needs support. We cannot do that barefoot. We could put steel where the foot isn't and needs to be. So that's the WITH protocol.
Great. Great. Like I said, everybody, you'll be able to find this article on the site tomorrow, linked to with this webinar video. Another question about the temp gun, Steve. What specific model do you use, or do you have any other recommendations of other models?
I just bought one at an auto parts store. They're usually under $100 for a decent one. And there's no specific one. It's just got like a little laser pointer. The closer you have the gun to the foot, the smaller the area that you are getting. So you want to be about 3 inches away from the horse's foot to give you a very fine, focused area.
Great. Can bruises become abscesses?
Certainly, that's a very good point. A bruise can turn into a necrosis, and that turns into an abscess. So certainly, and it could be a bruise on the bottom of the foot, like a horse stepped on a rock and damaged some soft tissue, and that then finally kind of, it's no different than, you get a black and blue mark. Somebody, you get hit with a ball playing some sports, and sometimes that can turn to an abscess in your arm, in your muscle, and sometimes just some tearing of the laminae, like in a bruise, can also do that also. So yeah, that's for sure. That can happen. Doesn't always happen that way, but certainly can.
Okay. Do you recommend working on an abscess with a vet present or not? This farrier mentions that his customers in his area live far out from a vet office and typically won't pay for the call fee.
Well, that depends on a couple things. One thing you want to think about is what's your comfort level with this? Have you, one thing I do with the students, we work on cadaver feet, and I say, okay, start digging away, and then dig more. Learn it, how to recognize sole depth. How far can I go without harming the horse? So getting comfortable with this stuff is part of being able to do this comfortably without the vet. If it's something that's really extensive, the horse is really lame, you can't find anything, then yeah, you're going to need a vet sometimes because you're stepping out of your realm of where you should be as a farrier. The more lame, the more extensive the problem, the more likely you're going to need a vet. Quite often, if it's a simple problem, you can resolve it by, again, doing the things we talked about earlier. And I don't believe you need a vet for every abscess, but the more extensive the abscess is, the more likely you're going to want the vet. The vet can help with radiographs, he can help with sedation, sometimes even nerve blocks if the horse is really bad. So it's a teamwork approach as the complications get worse.
Okay, here's another question from a farrier. I recently had a client that had a vet suggest to her that she soak with a mixture of betadine and Epsom salts. I was always under the impression that iodine products toughened tissue, including the horny sole. When attempting to draw out the abscess, wouldn't hardening, toughening the surrounding tissue be counterproductive?
What you want to really do is try and draw this stuff out, and that's your hypertonic solution. But you also want to create granulation tissue also. So yeah, you want this to heal from the inside out, but it's a very good cleansing to do it that way, and it's not going to immediately harden up the foot.
Okay, and then we have one final question, and about towing that line of vet farrier responsibilities. Since we, as farriers, can't legally diagnose a lameness, how do you tell a client your judgment tactfully?
Oh, that's a tough one. It just, obviously if the horse is lame, or sometimes, you're pairing away, you don't even have a lame horse, and you're pairing away, and then there's a little surprise as some black stuff starts, or maybe not even black, some serumy stuff starts coming out. You're already involved. You want to look at this. You want to tell the client what's going on. You want to talk about disinfecting. I think that's in the realm of the farrier. If something is more extensive, then you have to say, hey, look, we have a problem here. I think I need a vet. So I think, each individual case has got to be different. And quite often, if a horse is acutely lame, they're more likely to call the vet first in many cases because the vet is more of an emergency person for them. Whereas they know they may have to wait a week for a farrier or more to, get to them, especially if they're far away. So I think it's a case-by-case situation. Some of my clients over the years in my private business, unless the horse there was dramatically something that they could see, if the horse was lame, they'd rather call me than the vet first. And if I could get there, I could sometimes find an abscess, probably save them some money, but if I didn't find anything, then again, that serves as, okay, we need to call the vet to look further.